How are you?
Duchess is a 9-year-old lab mix who is suffering from a lump in her head and a persistent discharge from her left eye.
Well, my concern is we know she's not feeling well, and her skull is caving in. There's a concern that what is going on inside of her head is cancer. She's a part of the family, so we're hoping for the best, and that it's not.
Dr. Hottinger, a soft tissue specialist, orders an MRI and conducts a physical exam.
Can you look at me, baby girl? Here we go. So this little lady has a condition going on in her middle ear. Could be cancer, but more likely is a benign process called a cholesteatoma. It erodes through bone. It actually is invading into her brain, compressing her brain. So she has a lot of muscle loss right here, rounded over here, caved in here. And then also her eye is sunken, and she's not producing enough tear either. So she's got an ulcer on her eye.
Surgery appears to be the only option for Duchess.
Hi, Mr. Sparks.
Hello.
I'm Dr. Heidi Hottinger.
Nice to meet you.
Have a seat. We're going to talk about a few things. So I can't give you a guarantee yet that this is not tumor.
Right.
I wish I could. But she does fit a lot of the picture of a dog that has this condition, which is called a cholesteatoma. Here's what we know about them, is that if we can go in and get a lot of that waxy material out, we can kind of get a lot of this under control. Things we have to keep in mind, though, is that some of the nerve damage that is present may not go away.
Oh, I understand.
So, the biggest thing I do have a concern about is the eye.
Okay.
There is the option of saying, wow, if all of this is to make her feel better, if she has an eye that's always ulcerated and painful, maybe she would be better without that eye.
Okay, I agree.
Let me show you a few things on her MRI, too, so you kind of know what we're doing. So here we have this little bit of black. Here we have this great big area of kind of white stuff. And look at her brain on this side. Notice how it's touching her brain?
I do. See, we really don't know if it's a tumor till you get in there.
We
do
don't. So here's what we would do. When I go in, if it's tumor versus this cholesteatoma, they look completely different. They have a completely different texture. I'll know. If you want some time to think through all of this.
The truth is, it's not going to get better. It's going to get worse.
Correct.
And if we have a chance to retard that,
yes,
and give her a good quality for a while, that's kind of what my wife and myself have decided to do.